mental health inpatient services. My name is Councillor Mariana Masters. Before we start the meeting, I have a few announcements to make about the meeting rules. This meeting is hosted by Southwark and will be recorded by the Council and uploaded to Southwark Council's YouTube channel tomorrow. Please note all guests will have their microphones muted when they join the meeting. You will be asked to remain on mute unless I ask you to speak. Please do not open your microphone until I have given you permission to speak. Attendees who are using the telephone dial-in function or smartphone are asked to mute their microphones directly on their devices. Open microphones may cause feedback. To ensure that this virtual meeting runs smoothly, only one individual will be allowed to speak at a time. Any person speaking must be permitted to finish what they are saying without interruption. If I ask that an individual stop speaking, they should do so immediately. Interruptions may result in you being disconnected from this meeting. If a member of the committee wishes to speak, could I ask that they indicate this via the chat function on this application or using the hand icon. Please note all guests will be made attendees after they have entered the meeting. A message should now have been shown on your screen to indicate this has been done. Bearing in mind that a recording of this meeting will be posted on the Council's YouTube channel, if you're planning to speak at this meeting, you may choose to switch off your camera so that only your voice will be heard. Members of the public who are disconnected from the meeting due to technical difficulties should use the link or dial-in instructions they have been sent initially to return to the meeting. If a member of the committee or officer loses internet connection or power, can they inform Fitzroy Williams of this via email? And his email is fitzroyantonio.williams@southwark.gov.uk immediately, so we can adjourn the meeting until the connection has been restored. Members of the public are welcome to record, screenshot or tweet the public proceedings of the meeting. A copy of the Council's protocol for reporting and filming is available on Southwark's website. During the meeting, members of this committee will not access the internet except as it relates to the official business of the meeting. Send or receive emails, texts, messages or tweets concerning the business of the committee to anyone outside of the meeting. Please note that members may be accessing the agenda via the internet. And finally, in the interests of health and safety, we'll be taking a 5 to 10 minute comfort break at the end of each hour or thereabouts. That's the official bit. Thank you. Okay, now to move on to the agenda. Can I just first raise any apologies? Do we have any apologies for absence? Can I have confirmation of voting members? So can voting members please indicate you are present when I call your name? Councillor Victoria Alosa.
I have apologies for her, Chair.
Okay, thank you. Councillor Maria Linforth Hall.
I think she is also unlikely to be able to make it, so apologies for her too.
Fantastic, thank you. Councillor Nanda Manley Brown.
Present.
Oh, present. Fantastic. Thank you, Nanda. Councillor Joshua Lindsay.
Hello, Chair. Present.
Fantastic. Councillor Charlie Smith.
Here, present.
Fantastic. Thank you very much, everyone. The second point of the agenda is the election of the chair for 2020-21. I'm now going to briefly hand over to Julie Timbrell, Scrutiny Project Manager, to conduct the elections in the interest of neutrality.
Thank you. Do we have any nominations for the position of chair?
I'm nominating myself.
Yes.
So forward. Thank you.
I'll second you.
Excellent. Thank you. So would all members be able to indicate via the chat function whether they are voting for Mariana Masters? Or put up your hands. A hand.
Yes, yes, yeah.
Yeah, that's Charlie. Thank you.
Good, good.
Looking in the chat. Okay, that's Councillor Joshua Lindsay. And Councillor Nanda Manley Brown. So do we have anybody who hasn't voted yet? No. Okay. Right, that looks like it's unanimous.
Great.
So congratulations, you're chair.
Thank you.
And now moving on to the position of vice chair. So the position of vice chair needs to be held by a different authority. So that would need to be someone from Southwark. Do we have any nominations for that position?
Could I nominate Victoria Alusa?
Yeah, thank you, Victoria Alicia. So could people indicate by hand or icon or chat whether they accept that and would like to vote Councillor Victoria Alicia as vice chair? Charlie, you've already indicated that.
Yeah.
Okay. That looks like it's Councillor Nanda Manley Brown. Yeah, so well, that looks like a majority, so that's agreed.
Good.
Thank you very much, everybody. I'm going to hand back and mute myself to the official chair now, Councillor Mariana Masters.
Thank you very much, everyone. Thank you. The next point of business is disclosure of interest and dispensations. Does any member wish to declare an interest or dispensation in respect to any of the items on the agenda?
No, Chair.
Okay, great. Is there notification of any items of business which are deemed urgent that we need to bring in? Nothing has been flagged up. So we can go to the next point, which is to confirm that the minutes of the meeting held on the 6th of February 2020 were agreed as an accurate record. Does anyone have any objections to the meeting notes? They should have been circulated.
Agreed.
That's fine. Okay. Anyone? Yeah. Okay. Great. Okay. Terms of reference update. There should be updated terms of reference, which were sent out with the supplementary agenda. And I guess the next point is the update on the consultation. So Southwark Health Watch have provided a paper in the supplementary agenda, and the presentation attached will be presented by Matthew Longmate, Director of Strategy and Development Consultant, Health Advisory Partnerships. Such long titles. He will share his screen with you all shortly. Is Matthew able to take?
Okay. So I'll share the presentation now, and I'll hand over to a number of my colleagues to take us through the presentation itself.
Brilliant,
okay.
Thank you.
1 second whilst this loads.
Yeah, I'm just to let everybody know that with the presentation, there will be contributions from NHS, SLAM, Health Watch colleagues who will be on hand to contribute to the item. Yes. And if you could perhaps please introduce yourselves and state your role.
Okay, thank you, Chair. Shall I make a start? My name's Andrew Ears. I'm the Strategic Director for Integrated Health and Care at Lambeth CCG, South East London CCG and Lambeth Council. And I'm going to start off, and then I'm going to hand over to David Bradley, Chief Executive of SLAM, and then other colleagues are going to take you through the presentation. So just to start off, so thank you very much for the opportunity to talk to you again. I think this is now the third time we've had a discussion. Obviously, just seen the minutes of the first meeting, and then you had the virtual tour and a conversation at the end of March. The proposals in front of us and that we've been consulting on as a CCG sit in a wider suite of service change and transformation in the borough and mental health services, in particular around the development of our community mental health services with the Lambeth Living Well centres and so on, led by the Lambeth Living Well Network Alliance. But the inpatient bit, which is the subject of this consultation is important to us as well, particularly around the quality of care offered to those individuals who require an inpatient stay. So it's an important component of a wider system change for us. I'm going to hand over to David now just to summarise, I suppose, the absolute key drivers around our thinking. David.
Thank you. Hi there, everybody. My name is David Bradley, and I'm the Chief Executive of SLAM, South London the Maudsley Trust. So I'd just like to echo what Andrew's saying, and really what this consultation all been about is how do we improve the inpatient care and the facilities that we've got for people across Lambeth and Southwark. And we know that good physical environment, good inpatient care and wards, essentially wards, allows better outcomes for people. It's, going into hospital when there's a really good environment improves the outcomes that people get from that. So this is essentially what we're trying to do with this and this consultation. It's about building new facilities, and that's at the heart of this. It is the first stage in longer term improvements that we're making across the whole organisation. But this really is an enabler for us to do, and really an important part of our strategy of continuing improving mental health across the boroughs. So I'm just going to pause at that actually, and I think going through the presentation will give more information and more context to this.
Thank you, David. So just the presentation is in three parts. The first is a recap of your last conversation around and the virtual tour and so on that you had at the end of March. Then we're going to give you an overview of the outcomes to date of the consultation process, so how the process has been run and the feedback we've had. Obviously, we're not quite at the end of that process yet. And then thirdly, there's a to reflect the changes in your terms of reference you've just agreed, an introduction to some of the other service changes beyond the direct Lambeth ones that have a relationship but are not directly involved in the consultation process at the moment. So on that note, I'm going to hand over to John Lavelle, and I'm hoping that the slides are working. Yes, they are. John.
Thank you, Andrew, and thank you for your time this afternoon. So I've just got a few slides. Sorry, my name's John Lavelle, and I'm the Service Director for the Lambeth Mental Health Services for SLAM. And I've just got a few slides which will recap on the process we've been before and the information that the last JOSC saw. And members will remember that we had a meeting at the end of March where we took you on a virtual tour and overview of the service. And I just wanted to recap on a few of those points. So I think the first slide really just the key point is to say what we want to achieve out of this is to improve patient care and experience. And we have 4 ways in which we are aiming to do that. And so that's improving the quality and safety of our inpatient wards so that we can meet the most basic needs of our service users and our patient group. It's been committed to supporting people in Lambeth who are experiencing mental illness or distress. We have the opportunity here to have a new purpose-built mental health unit, and working together with partners as part of the health economy, planning and thinking about the needs of service users and patients across all of our boroughs. And Matthew will move us on. So those who were on the virtual tour will remember some of the photos that we had a look at. And I suppose I'd like to draw your attention first of all to the 3 smaller photos. The left-hand side, top left-hand corner is one of the bedrooms on one of the wards at Lambeth Hospital, and then the 2 smaller ones on the right-hand side, the dining room area and current day service area. And I think they speak volumes in terms of the photos of the paucity of the environment that we're currently expecting service users and staff to be in. I'd particularly like to point out the current dining room area, and in the very far corner, I appreciate it's a very small photo. There is a small hatch next to a window, and I think it it points out some of the issues we have in terms of our environment. So that is a hatch by which service users have to receive their meals on this particular ward, and I think everybody would agree that that isn't the most pleasant way to receive a meal, particularly when you're unwell and distressed. So I'd like you then to take you then to the larger photos, the left-hand one of which is a proposed bedroom in the new service, in the new environment. And comparing it to the current bedroom, I think you'll be able to see there's a marked difference. And then to the larger photo on the right-hand side, which again is the day space and dining room area combined. And again, you're comparing to the current accommodation that we have, you'll be able to see the difference in terms of light, access, etc. And then just at the very corner of the photo, the larger photo, is just the demonstration of what the outside accessible space will be for each of the wards. And it's just worth noting that not all the wards on Lambeth Hospital have direct outside accessible space, and a lot of it has to be controlled by staff, and I do use the word controlled. And obviously we want to move away from that way of working with people, but this space would be accessible, freely accessible for people using the service. And then Matthew will move me on, I think. So this just takes us through, and it's a reminder of our preferred option. So we looked at two options. The first option being that we remain as we are and we do nothing. And then the second option, which is our preferred option, is that we relocate 4 of the acute wards and the psychiatric intensive care unit to the Maudsley site. So the wards we'd like to move are the Rosa Parks, Nelson and Luther King, which are acute admission wards. Our Leo ward, which is a ward for people who are experiencing first episode psychosis, so an early intervention in psychosis ward. And then Eden ward, which is our PQ. We did look at the option of a facility on the Lambeth Hospital site. However, that failed to meet the 2 main key tests. So was the option realistic? And this option required an additional capital of between 30 and 35 million due to the infrastructure issues that we have on the site, and the need to decant at least 1 ward to the Bethlehem and 1 ward to the Maudsley, which would cause significant disruption, which made this option unrealistic. And then the key test of it was this option sustainable. And given the levels of efficiency savings and the additional savings that would be required, this was felt to be unsustainable, this option. So I'll just pause there and see if there is anything, any questions any members would like to ask. And if not, I can hand over to Jane, who's going to take us through the overview of the consultation.
Thank you, Chair. My name's Jane Bowie. I'm Director of Integrated Commissioning for Adults, and I work across Lambeth Council and the CCG. And I'm going to do this jointly with my Associate Director, David Orikaya, who will now introduce himself as well.
Yes, David Orikoya. I'm Associate Director for Integrated Commissioning for Mental Health in Lambeth Council and the CCG, borough-based CCG.
Thank you. So David's going to kick off with the first section, and then I'll come into the second.
Thank you, Jane. Yes, just as a kind of quick recap, as members will know, we launched the consultation on the 4th of March, and it is due to run until the end of this week for a period of so just over three months. We had initially envisaged a full consultation programme with a number of face-to-face meetings, and as you may be aware, as a result of the COVID-19 outbreak, following consultation with key stakeholders, which included the CCG, the Lambeth and Southwark Joint JOSC, and NHS England London, as well as the Provider Trust and partner agencies, we agreed that we would continue the consultation, but that it would be virtualised, so that we, and the reason for this is because we'd obviously started to receive good levels of feedback, and we wanted to maintain a clear focus on monitoring the ongoing level of engagement that we would receive through the process in order to make sure that it was full and robust. And so to date, we have received very positive feedback from across our stakeholders, including patients, the public, and staff. Engagement, we also had quite a significant amount of engagement before the consultation went live, and that was starting back in 2019 in May, with both staff engagement and letters to key stakeholders. We had also in September engagement with key members, including key members in Lambeth, and also with our Living Well Network Collaborative, and also members of our Keep Our NHS Public, and that went through, so on, as you can see, right through to October and November and January, which included also engagement with the London Clinical Senate and other key stakeholders who were broadly very receptive of the proposals.
So as part of the consultation, we looked at the documents and the way that the information could be set out, and we made sure that we had a variety of different formats to present the information in, including summary documents and easy read versions, so that we could reach a wide range of audiences. We also look to promote events and to promote the consultation over a number of different areas. We looked at a range of addresses that we posted information and adverts out, both close to the Lambeth Hospital, but also close to the Maudsley Hospital. And again, made sure that we disseminated a variety of summary bits of document across pharmacies as well, just to make sure that people were aware that the consultation was going on. And this is a list of the proactively engaged stakeholder groups that we had. Now, we had levels of engagement and levels of involvement vary between those different groups. So some of them were really quite heavily involved with what we were doing, and some on a less extent. But that was the list of groups that we'd had engaged in this process.
So I will continue on with just a quick summary of the engagement activity. So as we see, we had extensive social media engagement, and that include throughout the whole process, and that included providing information on the proposals, including describing what the building environment looked like, the reasons why we wanted to do this, and also how people could be engaged in the consultation process, so that they had the maximum opportunity to input their views. Moving on to the next slide. As mentioned, we had engagement with a number of key stakeholders, and this kind of just describes some of the promotion that we sent out. A particular focus for us was to ensure that we made sure that our staff, but also key affected communities, including people from our BAME and other communities, had an opportunity to know about the consultation process and were engaged in it. And we made sure that we disseminated that information as has been set out. We also had social media shares from a number of our stakeholders, and that includes Health Watch, Black Thrive, Mosaic Clubhouse, which is a kind of user-led mental health support organisation within Lambeth, and those have helped to amplify the message across across our local residents and our population, to ensure that our key stakeholders were informed about the potential to engage in the consultation process. We've also run a number of public consultation events, which have been advertised both online and through our local press. These were virtual events, and we've also managed to hold a focus group as well. One of those events took place last week through Healthwatch. However, the second event, as a mark of respect arising from the unfortunate and tragic death of a service user, it was agreed that as a mark of respect to that individual, their family and their loved ones, that Black Thrive, who are hosting the event, ourselves as the CCG and SLAM would cancel that event. But we have managed to hold some focus group events over the last week.
So some feedback, initial feedback from the consultation to date. And what we have been able to do is get input from a geographical spread across the area. We have had feedback that demonstrates representation across the different groups within the borough. And I think particularly importantly, the diagram down on the right-hand corner, we have been able to capture input from service users, from staff, and from members of the public. And on to the next slide. This is the feedback on the question of the need for change to date. And the theme is that the majority of responses that we've had to date are supportive for the need for change. Particular areas that are cited are that the environment would be more fit for purpose, and it would look to improve and streamline the services that are going to be delivered. There have been views expressed that there was an interest particularly in seeing whether we could improve the existing facilities, and an interest in seeing about whether we could continue to keep services in borough. And then at the bottom of that slide, what we are also doing is capturing some individual comments and some individual views as well, just to make sure that we are highlighting the breadth of different voices and different opinions that are coming through. And then feedback that we've had specifically on the move to Maudsley. And again, the majority of respondents so far have been positive about the move. One of the reasons is that they feel that the Maudsley site per se has had a good reputation in terms of the quality of the service that it provides, but then specifically as well that people feel or have stated that they feel that the quality of a newly commissioned service on that site would be improved. But there have been other views that have been expressed as well. And again, one of the issues is levels of comfort with existing service users on the current site And another aspect is that the Lambeth Hospital does get used for more purposes than just as inpatient care. Now that's the end of that section, but what we'd like to do is pause and see if anybody's got any questions or any points that they'd particularly want to raise.
Could I raise just one little thing, Chair?
Yes, go ahead, Charlie.
I mentioned this last week. A colleague of mine called Tom White, and I think probably a lot of people know him. He's been a campaigner regarding the Maudsley for a number of years to try and get the emergency A&E resurrected. I happened to speak to him on the telephone last week about this, about something else, and I mentioned this, and he hadn't heard about it. So I sent him a copy of the consultation for him to respond to. But he's a sort of a local campaigner, and he hadn't been on the consultation list. Real shame. Tom White. I guess one or two people know of him.
I'm sorry that we've not been able to pick him up. Just in terms of the lateness of it, I mean, what we might want to see is whether we can individually reach out to him and see whether we could even get some late comments from him at this point.
I think he's trying to get in something before the deadline, which is when? Day after tomorrow? No, Yes.
It's the 31st. I mean, if he was able to do that, we would very much welcome you.
Yeah.
Thank you.
Can I also call? I've just had a message in the chat from Catherine Pearson around the actual the consultation report, the pre-business case. Would you like to come in briefly, Catherine, and add to the presentation?
Yes, thank you, Mariana. I just wanted to say that Healthwatch has been visiting services. Is it okay? Healthwatch has been visiting SLAM wards for a number of years now. We were there 2 years ago to do entry reviews. We did some work with CQC, and last autumn we did some work visiting the wards as part of the pre-business case consultation. And our feedback was based upon 33 patients that we spoke to, 19 one-to-one in the individual wards, and 14 in community meetings, where we looked at the plans and we talked about problems with the existing wards. And I just want to say that the patient feedback was unanimously in favour of the move and for the design that's been put on the table. There were some issues raised by staff and carers, which people will be familiar with, to do with parking and various other things. But what patients were really saying was they liked the layout of the communal spaces and the access to the balconies, but they didn't think the access to the balconies was good enough on its own. What they really wanted to have was access to that space so they could move around and not always be in a room with a television on. But they also wanted to have things like access to Ruskin Park, to be able to have better quality outdoor space. They thought there was an opportunity here. They were concerned that visits to Mosaic Clubhouse would be more complicated from Denmark Hill than they are from the Lambeth Hospital site. But staff and patients were saying, could there be a way that the minibus service that takes people to the Bethlehem could be reconfigured so there could be a drop-off in central Brixton to allow that to happen? And that was considered to be a really positive thing to do with the care. And then the final thing was that really what patients wanted to say was, it's not just a building, it's an entire service that creates good, strong quality recovery. And they would like to be involved in shaping the way the programme of services were delivered in this new facility so that they could be totally geared towards their own recovery. Those are the 3 points we wanted to bring up.
Thank you for those, Catherine. I think it's been very helpful to have you and Lambeth Healthwatch involved in this process. It's very helpful to have those individual points, and I think those are ones that we can certainly look at giving consideration in terms of development. And I know that SLAM previously have taken receipt of the point about the transport, and it's also the level of comfort around becoming acquainted with a new site or a new area of delivery site. And I think that they have built into their programme ways that they can support that happening. And I think then in terms of looking at the design and the particular shape of the design, I think, you know, feedback and points on that, we would look and see how we could try and pick those up and include them as well.
Chair, can I ask a couple of questions on section 2, please?
Yes. Well, if I could just go to before I come to the members, could I just ask? I've had a request from Catherine from Southwark Healthwatch to give some feedback, and then I'll go to members, Josh. And yeah, is that okay? Yeah. So, Catherine, would you like to add to the presentation?
Thank you. It's not so much adding to the presentation at this point as asking a few additional questions. Is now the moment to do that, or?
Yes, I mean, in terms of adding, I meant, well, not adding to the formal presentation, but if you've got comments from it, then yeah, that's fine. Great.
So Southwark Healthwatch have not been as involved as Lambeth Healthwatch as you might expect, but obviously we do have a role in promoting the consultation to our members, which we've done via electronic means. I think my role here is primarily just to get clarity on whether we think Southwark residents have been adequately consulted? And obviously I realise the huge difficulties of the current situation, but most of my questions are about that. So firstly, I wondered how many people have responded to the consultation, because we can see the percentages for people in, for example, SE15 and different areas of Southwark, but we don't know how many people that actually corresponds to. That was the first one. Shall I keep going?
Yes.
Yeah. Okay.
Yes, please. Sorry. Yeah.
Sure. I was wondering if you have any information about the age range of the people who've responded, because obviously when consultation's primarily digital, age may be one of the barriers. However, I do want to note that it's really positive that Lambeth, Blackfriars were involved from a diversity perspective. I note that there was a Facebook advert, but it didn't say which target areas were used for the Facebook advert. I know when you do that, you can set them. And I don't know if it just targeted Lambeth or whether Southwark people were targeted as well. It would be interesting to hear a little bit more about the voluntary organisations that were involved, particularly, again, from a Southwark perspective. And finally, why was it not decided to use a leaflet in Southwark pharmacies as well as Lambeth pharmacies? So sorry if that all sounds really picky, but I feel like my role here is primarily to challenge on the engagement. So that's what I'm here to do. Thank you.
Fantastic. So I think in terms of it being comprehensive, can we go to the members' questions, and then we can get everyone to answer all the questions at once? Is that okay with the people that are presenting? With Jane, is that okay?
That's absolutely fine. I think it'd be good to get all the questions, and then I can,
just in case there's duplications.
Absolutely, Matthew's hands up, so I think I might pass on to him at that point. But yes, let's get the question.
Fantastic. Okay. Can we then go to the members? I see that Nanda wants to raise a question, as does Joshua Lindsay wants to raise a question. So if we go to Councillor Nanda Manley-Brown, please.
Thank you, Chair. So just to build on a few of the, and thank you to the speakers who presented the presentation up until this point. Just some points of clarity as it relates to, first and foremost, the stakeholders list that's outlined in the presentation. Those that are highlighted in bold, are those only, why is there a difference in the way that's been printed? Some stakeholders are highlighted in bold, others are not. Secondly, as it relates to the feedback, the negative feedback that's been received, what's the plan to address those concerns, for example, relating to like the medication collection and the impact of other services at Maudsley, and then the online public discussion that took place, the listening event. What was the overall attendance of that? I couldn't see that in the presentation, so I wondered if the presenters could kindly just expand a little bit further on those points. And then, I'll stop there for now because I appreciate that there are still other sections of the presentation still yet to be presented. But thank you, Chair.
Great. Okay. Joshua Lindsay.
Yes, thank you, Chair, and thank you to the presenters. Sorry to laden you with a whole load of questions, but I think just building on what my colleagues have said, there was a question mark in my mind about the comment in the feedback which said that the questions appeared to be guiding the respondents in a particular direction, and I wonder how it was decided upon. I wonder how the wording of the questions was decided upon. Building upon, I think it was Catherine who asked about social media, not just location, but I think that you might be able to also target age range and demographics. So if you could expand on that. and Nanda touched on the question about the negative feedback around people who pick up their medication. I think there was also some concerns about lack of public open space in the new development. So if you could expand on that, that would be very helpful. Thank you.
Great. I also have a couple of questions. The main question is not for the sort of negativity, if any, but the fact that even given the new ways, creative ways of reaching stakeholders via online, there is still a feeling that the consultation hasn't been as full as it could have been. People who've contacted me just today feel particularly aggrieved as through no fault of anyone's, but the last consultation meeting obviously was postponed due to a service user passing away, and so wants to have an opportunity for another such consultation to event to be rescheduled. So I want to know whether timing is a massive issue, because if this could be rescheduled in the next couple of weeks, then I feel that at least that opportunity would be looked into. And also, I would just like to open up, just in case there are is anyone else that is not a member wants to ask a question. Now would be the time to indicate. Very quick question. I haven't seen anybody raise any requests. Okay, fine. Okay, well, just to quickly summarize so that the questions can be answered. There is issues over the number of people that have responded, the age range, the fact that maybe the age range reflects people with that are more digitally friendly than older service users and families of service users. Also, targeting, whether targeting took into account equal preference to Southwark as well as Lambeth, so targeting areas on Facebook, leafleting, whether consultation has been wide-ranging with quite vocal stakeholders, and Councillor Charlie from Southwark, pardon me, I don't know, I can't remember your surname, whether his contact had been engaged with, because I gather he's quite a vocal contributor to the services. Also, the stakeholder list that had been highlighted in the presentation had a number of stakeholders that were in bold, but a lot that hadn't, and if there was some explanation as to that, whether that was sufficient, or whether that was going to be addressed. And yes, so a lot of them were around the sort of online public discourse and overall numbers, just qualify that. And yes, I understand that we understand that engagement had been made outside of the official consultation period, but within the consultation period, it would be useful to know the numbers to make sure that the consultation periods actually have the numbers in place to make it valid. And I think that's it. If I've missed out anything, anyone's contribution, would you like to remind me? And then they can be answered. Yeah. Okay. I'll leave it to the presentation team to come back.
Thank you, Chair. I think we will probably take some individual questions from different members of the team. And what I'd like to do is suggest that Matthew answers the first couple of questions that Catherine had raised in terms of some of the details from the consultation. So I'll pass you on.
Hi. So in terms, I'm just looking at one of the more recent feedback reports we've had from North East London Clinical Support Unit, Commissioning Support Unit, who are independently reviewing our feedback. So the feedback doesn't come to us, it goes to an independent group for that interpretation. So in terms of the total number of responses we've had through the survey route, that is 159 at the end of last week. So that's people that have gone through onto the website and filled in the consultation questionnaire. In terms of the age breakdown, so 44% of respondents are in the 25 to 44 group, 36% of respondents in the 45 to 64 year old age group, and 9% in the 65 to 84 age group. So hopefully that gives some comfort that it's representative of more than just those who are kind of technologically savvy in the younger age groups. Just if there's any others that I can easily answer whilst I'm speaking at the moment. So there's a question around the stakeholders on the long list of stakeholder groups that have been engaged, why some were bold and others weren't. And that really relates to the ones that were very proactive in supporting us quite actively through the process, as opposed to ones we had just made contact with and engaged with, but they weren't quite almost partners to our process. So that's why the ones that are highlighted in bold are highlighted that way. There was a point around the open space on the Maudsley site. And this ties in very much with the development of the clinical pathways moving forwards once we decide, if we decide this is the right way to move forwards post consultation. That will be very much looking at, whilst individuals have opportunity on all the wards to have free access to fresh air as they need it on the wards in the balconies, it will also be into looking at how we integrate things like the use of Ruskin Park more than we do now, how we can be supportive of users being able to access other spaces. And also the planning application requirement or planning permission requirement was for us to improve some of the green spaces around the new building. So the kind of walkway down from the main entrance of the hospital on Denmark Hill Road, Denmark Hill, right the way through to the Ortus at the back of the site. So there's a desire for the planners for us to make that much more accessible and green as well. So there's kind of those associated pieces that tie along with that as well. I think those are the key ones that I'm able to answer at the moment, if that's okay.
Okay, anyone else from the presentation team that wants to answer any questions that remain outstanding, or do we feel that all the questions have been answered?
I think that there was also a question regarding consideration of support for services to be provided elsewhere. I think it was picking up on a particular point that one of the respondents had made around getting their medication on the Lambeth Hospital site. I don't know whether John from SLAM's able to pick that up and respond to that question.
Yes, of course. Thank you, Jane. So I think what we have to do is a piece of work with our living well centres. So what surrounds our inpatient offer is obviously our community offer, and I think it's really important that we start to think about how our living well centre community offer can support people to access different parts of the services that they need to fulfil their needs, such as pharmacy. And I think it's really important that we look to the living well centre to do that, because I think we very much want the focus to be on how we, alongside this development, how we think differently about our community services, and we strengthen those community services so we can help provide people's needs, and we rely less on our inpatient services. So I think it's very much about a community response that is led by our living well centre services for things such as medication and pharmacy.
Can I just ask also, in going through the list of questions, I'm not sure if it's been correctly answered around the targeting for Southwark as opposed to Lambeth. Lambeth's targeting has been very good, as I've seen it in multiple places. But just to check what lengths, what actual numbers we've had from Southwark in terms of respondents, and perhaps whether there has been the same level of engagement.
I think Matthew might be able to pick that up as well.
Yeah, so if I just going to try and be technologically savvy and possibly not get it right, if I'm just wanting to move back a couple of slides. So on this slide, on the left-hand side, you can see the geographical distribution of responses. And what we're seeing, so there are Southwark postcodes who have responded with 2, 3, 4% of the response rates. Likewise to much of the Lambeth side of the patch as well. And obviously, right around the Lambeth Hospital has had the predominance of responses and quite a lot of public feeling around that at the moment. So I don't know if this sufficiently answers the question as to whether we're getting reach across Southwark and Lambeth as well.
I don't want to speak on behalf of the Southwark people, but I feel that the information regarding the consultation hasn't been as visible from the Southwark side as it has been from the Lambeth side. I hope that's a fair interpretation.
I don't know if I'm able to interject. I'm working with the team on the consultation, but just to pick up some of the points that were made, in that the Facebook advertising we did do did include Southwark as well as Lambeth.
Okay.
And the flyer that we produced was distributed both in Lambeth and in Southwark. So and a lot of the groups, if you look at the list, the list of organisations we contacted when we were putting that together with Healthwatch, Lambeth and Southwark, and Black Thrive and all the other people involved, that list does include groups both in Southwark and in Lambeth.
Can I just add something, Chair, to say, obviously the people most directly affected are Lambeth patients, because it's Lambeth patients who are currently in Lambeth Hospital, absolutely predominantly. So I don't think it's surprising if there's a weighting towards responses from Lambeth and those organisations which are supporting patients in Lambeth. So I think it's heartening to see responses from Southwark residents and organisations in terms of the impact on other services that aren't being consulted upon. I think that's the issue here. Whereas actually the prime, if you like, the prime impact of the proposals is around moving services for Lambeth people. So I'm not suggesting we shouldn't. I'm sure we could do more. I'm sure we could do more in Lambeth, but I think there is a kind of spread that probably reflects the kind of level of impact across the two boroughs.
And what we did seek to do was make sure that some of the key groups that we did capture, so that there was a carers forum held across Lambeth and Southwark. We did get those. We did get those groups from those particular stakeholders. Chair, I'm not sure that there's been an answer given just in terms of the cancellation of the event last week, and I'm happy to pick that up.
Yes, please.
We had a number of conversations that day, because it was set to go ahead right up until the day itself, and had a number of conversations that day, particularly with Black Thrive, to just try and assess what the right and the best response was under the circumstances. And we had a number of different scenarios that we talked through, and a number of different responses. And in the end, we did make the decision that we made. What we did do was contact directly all of those people who'd registered with that event. There wasn't a great deal of people who'd registered for that event on that day, but we did contact them all individually and invited them to come and make representation, or to come and talk to us, or make their views known in a different way. And I think, as my colleague has referenced, what we did also subsequently do this week was look at having a target focus group for people who have had experience of the service, who were particularly from a representative group of Black men of working age, so that we did make sure that that we were capturing the views and were getting the input of people who might have particularly been affected by the standing down of that joint event.
Great. That's been. Thank you everybody for contributing to the answers. I would just like to point in the reason why a lot of Southwark people are interested is they want to engage and understand whether these facilities will be available to them as well. So it's important. I appreciate that it's service users in Lambeth that are predominantly involved in this, but also Southwark want to understand that as the Southwark people that have been in contact want to understand whether these facilities will be ring fenced and they won't have access to them. So there's a bit of an explaining job there. And also in terms of the cancellation of last week's event, thank you again for explaining what work has been done in terms of contacting those who had registered. I guess word of mouth is has trickled in the last week, and so just today I've had 5 separate emails. So I'm wondering whether, obviously I can work and pass on details, whether there is a group in place to, in the time that the consultation is in place, either to work on people that have expressed an interest in consulting, in participating, or whether we could look at a short extension so that we can, again, these things, it's not a perfect science, obviously. This is a new way of consulting, and we just make sure that it's as full as we can. I do appreciate the work had been going on even before the consultation actually started, but in view of the fact that quite a few people seem to be responding at this late stage, is that something that can be addressed? So that's it from me. I don't know if anyone else feels that their questions haven't been answered and wants to make a point, or yeah.
Chair, the point about how the feedback forms were formulated.
Ah, yes. The leading nature of the perceived leading nature of.
Perhaps, Chair, I can ask Matthew to pick up the question of how the questions were formulated, and then maybe I can just come back to your last point around capturing the last voices. So if I ask Matthew to take up the point of how the questions were formulated first.
Yeah, no problem. So to be honest, we took a relatively conservative approach as to how we would formulate the questions. So we looked at one of the public consultations that's happened recently in mental health that's been flagged as one that worked really well. So looking at the Camden Islington consultations that happened recently, so we based our questions on theirs. So we know that it's been tested throughout an entire consultation process. So we had some comfort that we weren't necessarily driving questions in a way that kind of took people down an avenue. And I think the questions are relatively they relatively speak for themselves anyway. So do you feel there's a need for change? Is it reasonable to move to the Maudsley Hospital site? And do you have any other items where you think you or any specific group would be affected? They're the kind of core questions we had. So those questions themselves aren't leading. It certainly from my perspective, they don't seem to be too leading anyway. So I think what it might be is just the consultation itself is very much driven around the fact that we're looking to try and improve services, and therefore the narratives in the documents that sit behind all of this is about a very positive nature for change and a case for change, because that is what we're generally trying to do. So I think that might be just where the feeling came from, that not necessarily the questions are leading, just the actual documentation and feedback and information that sits behind the consultation is just about something that's put forward as being positive. I don't know if that answers your question, Councillor Lindsay.
Yes, very much. Thank you.
Brilliant.
And just to your last point about people wanting to be engaged and involved, I just had a quick check. Our contact details are on the last slide of the presentation, and I know we are on the 28th, but we still do have tomorrow if people are wanting to phone up and speak to any of us, or we have, right, you know, up until the 31st if people want to send in emails or send in comments. You know, we would like for them to be signposted to us, and look and see, you know, how they can make sure that their views are submitted, because we will then be able to include them in the consultation that we've had to date.
Thank you for that. So yes, definitely I will pass on details for those that have got in contact. I do feel that I mean, these things are never a perfect science, but I do feel that some of the questions that I've had has been the lack of awareness over the consultation, and that now that people are aware, are panicking that the time frame is ticking away, that, you know, people are, so I think, organising to actually be able to engage in the consultation. And so that's why a question came up as to the possibility of an extension, even if it were to be by a week or 2 weeks, that at this stage that would enable people to feel that they had enough time, sufficient time to respond and to spread the word. Is that something that can be looked into or considered?
I mean, certainly, I mean, we can, you know, we can and we do make consideration. I think one of the key principles of consultation is whether there has been sufficient breadth of opportunity and chance for people to make sure that they're making their views felt, particularly with making sure that key stakeholder groups and people who've got a particular interest are able particularly to be engaged and to be part of that. So I think it was part of the reason why we did have a midpoint review through the consultation, particularly in the context of the experience of the COVID pandemic, and therefore, you know, the slight change in terms of how you would ordinarily conduct a consultation. So in that context, you know, we were doing and we were evaluating whether we felt that we'd done enough, whether we'd got sufficient reach, and whether we'd captured the groups that we had wanted to do. I think within that context, again, in the same way as we did a midpoint review, we would similarly take a view about whether we feel that a consultation has been sufficient and robust for the purposes. So we would be absolutely giving careful consideration to the points that have been made this evening.
Okay.
I think we would encourage as well, though, that anybody who has a point to make it quickly and to get it in, so that we don't miss them. We want to hear people's views.
Yeah.
We're clearly working to a timetable we set as well, and we've given ourselves a kind of month to turn around to come back to you during June.
Yeah.
So what we don't want to do is kind of compromise that. So I think as much as possible, if people could get views in before the 31st, that would allow us to do that.
I suppose the other thing I'm conscious of is the environment in terms of having consultations, or different channels have consultations, aren't going to significantly change in a week or a couple of weeks' time. So the opportunity or the ways that people can make their views known are still going to be pretty much the ways that they're going to be able to do it in the next few days. You know, and we'll be really keen if people could pick up the phone and speak to us or drop us an email, and we will absolutely make sure that we capture that, and we would value their engagement and participation in the process right up to the 31st.
Brilliant. Thank you very much for giving really comprehensive answers to lots of questions. And I'll definitely thank you again to remind us of your details, so we can definitely signpost and get people who want to engage with you to actually come forward before the scheduled close of consultation. Okay, are we now okay to move to the next point on the agenda? Has anybody got anything, any questions with regards to the presentation, what they've heard already? Sorry, somebody speaking?
Apologies, Chair, it was me. I was just going to introduce my colleague Matthew because he was going to lead on presenting on section 3.
Okay, fantastic. Okay, go ahead.
Yeah, so you've heard my voice a few times, and sorry I haven't introduced myself properly. So I'm Matthew Longmate, I'm a Programme Director for the Lambeth reconfiguration supporting both SLAM and the CCG. So in the terms of reference change that you looked at earlier, we've introduced a few other services which are part of a broader programme of improvements. But we wanted to make sure that you're cited on these, so you get a good holistic view when you're having your deliberations and making your recommendations, things about this process, rather than just having a slightly short-sighted view on just the acute beds as we've seen at the moment. So sorry, let me get my computer to move forwards. So in terms of the broader programme of service improvement, there's a number of services alongside this public consultation that are going through engagement processes. And they form part of a broader programme. We're engaging with the relevant commissioners, service users and stakeholders to ensure a broad range of views are included in their development alongside this public consultation on the acute wards and the psychiatric intensive care unit. So these services which have been brought into scope of this this JOSC, just so to make sure that you've got a sight of them and are aware that these are likely parts of a broader service improvement programme, are a national neuropsychiatry service, which is commissioned by NHS England Specialist Commissioning, and also an national eating disorders unit, again from NHS Specialist Commissioning. They both at the moment are housed in the Bethlehem Hospital, and part of the proposal would be to move those over to the Maudsley Hospital as well, into this new building. We also have on the Lambeth Hospital site a service called Ward in the Community, which is a forensic step-down service, and that's for multiple boroughs. So it's not just Lambeth patients, it's for many boroughs across London. And that's currently at the Lambeth Hospital site with a view that it would move towards the Bethlehem Hospital. And then also on the Lambeth Hospital site is a rehabilitation unit called Tony Hillis Unit. And again, this serves multiple boroughs. And it's currently on the Lambeth Hospital site with a view that it would move towards the Southwark Hospital site. So there's a small graphic at the bottom just describing kind of that little spider's web, just so you can, if you're more of a graphical thinker like I am, hopefully that makes some sense. So in terms of the case for change for these services, they're very similar in terms of those the kind of key drivers for the inpatient services as well. But one thing I want to make clear is that we're not talking about any change to the scope or breadth of these services and not reductions in beds. So very much the similar situation with the inpatient services we've been talking about to date. The main drivers are around to improve the accommodation, which, because obviously poor accommodation reduces the efficacy of care, doesn't support the safe environment service users and staff, and these services are far behind in terms of offering dignity and respect to service users. So all the same things we've seen: poor accommodation for ensuite bathrooms, bedrooms themselves, and those day spaces that just don't seem fit for modern day healthcare. In terms of the neuropsychiatry unit itself, this has been specially designed in this new building, and that's one of the good things we've had an opportunity to do whilst looking at creating a new building for the acute inpatient services moving to Lambeth, is that we're able to develop something that's absolutely bespoke to the needs of them. So they've got much larger bedrooms to accommodate kind of wheelchair access and King's Fund style beds, very big mobile beds that are required, and also allowing clinicians to have access around the bed to the service users as well to be able to support them. And they also have step-free access to an outdoor courtyard for free access to fresh air as well. So something that's very, very positive for them. For the eating disorders, likewise, going into a new unit means that we can design it so it's completely fit for purpose. So this one really focuses around the dining experiences and kitchen spaces for service users, which can be used as part of their therapeutic management plans. So something that really works in terms of making their pathway of care much better whilst they're in the inpatient environment. The real driver behind moving some of these to the Maudsley Hospital site as well is that there's a proximity to King's College Hospital and the acute physical healthcare just across the other side of the road. So obviously, neuropsychiatry patients and eating disorders individuals have needs more over and above those of a normal inpatient service user, and often they're quite physical health needs as well. So that proximity allows that to be much simpler to work through. And also means that we can create multidisciplinary team working between the acute physical health teams at King's College who can support some of these specialist services, and also the mental health services just across the road. So hopefully there'll be a much more holistic, joined together pathway of care. For the Tony Hillis unit, this is a service that works across a number of boroughs, and there's a growing predominance of Southwark service users in that ward over on the Lambeth Hospital site. So what's felt at the moment is actually moving that back to the Maudsley Hospital site will mean it aligns better with the Southwark service user group, with the activity profile we're seeing that service as it develops at the moment. So there's a good alignment there. And then finally, the ward and the community service, as I mentioned, was a step-down forensic service. This has a clear relationship with a large acute forensic service that's provided on the Bethlehem Hospital site in the River building. There's a good couple of hundred beds, I think, off the top of my head, of forensic inpatient services there. So having this step-down facility somewhat aligned to that allows us to be able to support the pathways as individuals get to step down from those services. So that's just a very quick overview, just to give you an idea of other things that are happening that we're wanting to all try and join together so we can make the best use of this new facility, allow for some really good bespoke design for specialist needs, but then also try and make some of the alignments of kind of cohorts a little bit better as we move forwards with the Lambeth Hospital reconfiguration. And that was all I had. Are there any questions from anybody on this particular section?
No.
Any from any of the members?
No, Chair.
Fantastic.
Okay.
Okay, I think that was quite comprehensive. Yeah, fantastic. Thank you. Okay, so these are the contact details that we are to put to anyone that still wants to participate in the consultation. Is that correct?
That's correct. Yes, please.
Fantastic. Okay. In terms of, can I just go back to that slides that had, I think, some stakeholders that were, all stakeholders that were involved, but some that were more engaged and others that were in bold. Is there a way of us just sending out just a final nudge to everyone, just to obviously, the last few days of the consultation. And then I too will pass on, and all members will pass on any other direct sort of contacts to the team as well. So if that could possibly be done, or if that's already been done, then that's fantastic.
Yeah, so we're in the process of that kind of final push for people. So yeah, fantastic. So hopefully you'll see lots more things that you can retweet and those type of things and spread between stakeholders. That'd be lovely. Thank you.
Great. Fantastic. Okay. Has anyone else got anything to raise before we move on?
Chair, would it be helpful to just outline what we think the next steps are beyond the 31st of March?
Yes, that's I think that's the next point of the actual agenda. But yes, if you would like to jump in and give us a...
Sorry about that. So from our perspective, so obviously following the close, we'd want to take a bit of time to consider all the feedback we've received and received that report from the independent report and then consider the outcomes of that. The next step would be for us to develop a decision-making business case to support our decision-making as we get in terms of and the response to the consultation. We'd want to come back to you before the end of June and before any decision is formally published and taken about the direction, so that we could engage with you on that. And in a sense, this is why we it doesn't give us an awful lot of time to turn that around.
Yeah.
But at the end of June is when we come back to you, and then the formal decision making would need to follow through our normal public processes of public meetings of the CCG and the trust board meetings, and that would be during July. But it's a pretty tight timetable going forward. But that's the kind of broad outline of where we would go next.
Great. Does anybody else have any input in terms of time frame or objections or observations?
No.
Great. Okay. Great. So I guess then it would be the next point is to agree the work plan and the date of the final meeting along with these next steps. So the reporting back will be before the end of June. So did we agree? Can we agree on the next sort of the timing of the next meeting to tie in with have discussions been made as to ideal timing for the next meeting?
So from our perspective, it would be quite useful towards the end of June, so the last week. I know that kind of splits over kind of last bit of June, beginning of July, just to give us enough time to obviously, as Andrew said, go through the feedback, pull the decision-making business case together, and those type of things, so we're ready for a conversation. So that targeting that week would be really helpful. And that also then gives us enough time to have the conversations with yourself before it goes formally into the public domain, with board papers and things for June as well. So that kind of fits for us, if that works.
Yes, great. From Lambeth's perspective, we looked at that week, and I think general consensus was around sort of the 1st of July. Yes, if we can get some kind of consensus as to when the next meeting should be. Do we do this offline? Sorry, I'm not sure how we go ahead.
Southwark has a Labour group meeting at 6 o'clock on the 1st of July.
Oh, okay, fine. So that rules that one out. Okay.
So shall we work with Julie and Christian to arrange a date that works for everybody? And then they can obviously have a discussion with yourselves and see if that works.
Perfect. Okay, great. Fantastic. All right then. So we've had, thank you, Andrew, for outlining the next steps. Is there anything in terms of Christian or Julian, help me out? Is there anything else I need to remind everybody about, or in that case, is that the sort of the business concluded for this meeting?
Chair, I think you've covered everything.
Fantastic. Christian?
Nothing for me, Chair.
Fantastic. Okay, great. Well, thank you very much. Thank you for your patience. I will hopefully remember everybody's name and be able to pronounce all the organisations' names properly next time. And that concludes the meeting. Yes, thank you very much.
Thank you, Chair.
Thank you
very much.
Bye-bye.
Thank you.
Bye. Thank you.
Right.